Ready? Okay, I'd like to call the meeting, January meeting of the Human Services Committee to order. Do I have a motion to approve the minutes? Is there a second?
Second.
Okay, all in favor?
Aye.
I guess I should say that was for both November and December. Is there anyone here to speak to the privilege of the floor? Seeing no one, we will go to the first tabled resolution, which is to amend the 2023 budget to implement the morgue project using funding from the American Rescue Plan Act, ARPA.
Good evening, Dr. Mike Falk, County's Chief Medical Officer, overseeing our coroners program. I would probably recommend to the committee to continue this tabled resolution. I've had a chance to, and just to kind of review what we discussed last month, we're leaning more away from a portable trailer, more towards a brick and mortar type of morgue facility as recommended by the committees last month rather. I've had the chance to look at a couple of different options, but I really want to look at far more options. One option was based at one of our county hospitals as an outbuilding that would probably require some work to for security's sake, and the morgue, the cooler itself, we requested originally $100,000 in ARPA funding. The cooler itself runs about $45,000 to $50,000 for a 6 to 9 decedent cooler, which would satisfy all of what we would need. So that would give us some extra money to kind of do some modifications if we need to, depending on what we find. I am also in the process of reaching out to the sheriff, director of public facilities, and director of emergency services to kind of keep an eye out for available county already established facilities that may not be, in the process of being utilized. We don't need a ton of space, maybe a 25 by 25 foot space, but it obviously has to be secure for obvious reasons. We'd prefer it to be staffed somehow or another, which like at a hospital would be ideal because they'd have 24/7 staff. So it's a work in progress, and we will continue to update you guys as we move forward, with obviously a goal of trying to come up with a plan by mid-year so that all of our purchase orders can be placed before the end of the year.
Okay, are there any questions, concerns from the committee?
Mr. Chairman, if I might, just to clarify, if the committee doesn't bring this resolution off the table and it remains tabled, it's dead. So that means that Dr. Falk would have to submit a new resolution when he has come to a conclusion that he would like to present. And that's not a bad thing. That's just procedurally the way it works.
Could we bring it off the table and table it again?
Why would you do that? He's gonna rework this resolution, it sounds like, substantially. So let this one die, and when he's come to a recommendation, he can form a new resolution to bring to us. That would be my recommendation.
So no questions?
So you can still talk about this one, but
Oh, okay.
just leave it tabled tonight, and then it's dead.
Okay.
And then he can go forward and bring a new resolution when he's ready.
I just wondered what if you have any sense of the cost of the difference. Is it a fairly comparable cost?
For the trailer ran,
Not so much, it sounded
yeah.
like if you went to brick and mortar, you have any sense?
I don't. I think it
Yeah.
all depends on what facility we can utilize. I mean, ideally, we'd find a spot within a hospital that maybe we can contract with, and we could use the funds to purchase the cooler system and then utilize hospital space. but that real estate is, not very available. So, I'm in conversation with all 3 county hospitals, in addition to our county folks. And I probably, as a next step, would reach out to our municipalities. I mean, if, we may have a municipal building somewhere within the county that we could utilize if it's not being used. So the trick is to really find a space that's secure, so. But and Mr. Landy, I don't think you've heard the conversation yet, but I'd be happy offline at some point to kind of bring you up to speed on where we've been with all this, morgue stuff, so.
Anything else? Okay.
Question, sure. This money has been earmarked by the ARPA committee for this project. If we don't bring it off the table, and does he have to re-go through the ARPA project committee again?
It's still designated for this project, even though this committee and the legislature hasn't taken any action on it yet.
Okay.
Yeah.
So it'll stay that way until we.
Vote on it, or?
Yeah.
It's designated for this project. You just don't have a defined project that you're in favor of yet.
Okay. So I wanted to make sure too, so you knew that, I mean, the money is secure at least, so you
Yeah,
wanna keep
no, I
moving
appreciate
forward.
that.
But also, there's a point too where it can't be 8 months either, right? So-
Right,
Yeah.
right, yeah, we have to have those purchase orders put in, by the end of '24, by the end of this year, so. It may be a challenge to really, if we're leaning in the direction of brick and mortar, it may be a challenge to get it under that $100,000 limit for ARPA. But we'll do our best, we'll see what the options are and go from there.
Okay, so what are we doing?
No action. Just do nothing.
Okay.
Move on.
So, move on. Thank you, Dr. Falk.
I don't know if it
Number
helps
2, our
you do
local
nothing,
law
do I?
introduction, 1-24. A local law amending local law 13-22, providing for a management salary plan for county officers and employees, administrative coordinator for the Department of Health.
So this is part of the restructuring and sort of the demerger of health from social services. We have a current position within the health department titled Assistant to the Commissioner for Social Services, which obviously is not relevant. And those job duty statements that go along with that title are not relevant. Our plan will be to essentially retitle the position to Administrative Coordinator and list the typical work activities in the job position duty statement to be relevant to what that filled position is already doing within the department. So we're not adding on a new position. It's just a retitling of a current position that's already filled. The management salary range for this position is the same. The position is already budgeted for in the 2024 budget.
Is the position filled in the old title?
It is filled under the old title, yes, right. And we've detailed the position duty statement and the typical work activities to be more in line with what that individual is actually doing for the health department. So administrative coordinator is equal to the glue that holds the health department together.
Any questions from the committee?
No.
And we do not vote on this.
Not a local law.
Okay,
Thank you.
Number 3, the proposed resolution to confirm appointment for the Chautauqua County Youth Board.
Hello, James Feldman from the County Executive's Office. So for this resolution, we have one appointment for the Youth Board, Legislator Dalton Anthony. The Youth Board's very excited about bringing Legislator Anthony onto it because not only is he a liaison to the legislature, but he actually can serve as one of our 2 youth representatives on the board since he's only 20. So we would be very excited to have him on the board.
Sounds good. Any questions from the committee? All in favor?
Aye.
Aye.
Thank you.
Okay, now we have a discussion from the Health and Human Services Division of Temporary Assistance. Diane Anderson.
We'll both say our names, probably. Hello, I'm Diane Anderson, Director of Temporary Assistance.
And I'm Katie Geis, Executive Director at Chautauqua Works and the contractor for the employment services.
Okay, so we're talking about the month of September. Our reporting is a little bit behind because of the way we get reports in. So the participation rate for all of New York State in September was 13.4%. The rest of state participation rate was 10.1%, and Chautauqua County's rate in September was 9.1%, so only 1% lower than the rest of state number. And Chautauqua ranks 40 out of 57 counties, or 17th in the state for the highest participation rate. We had, in the month of September, 46 individuals participating and counting for the participation rate. And the total number of recipients who were engaged was 156, which is included in the number that counted. So there were 110 who were doing something, but just not enough to count in the rate. If we only looked at the non-exempt individuals, the participation rate would be 13%. In the month of September, there were a total of 37 conciliation notices sent to people who are not participating in the work activities up to the maximum number of hours that they were required to do. And 30 sanctions were processed during the month of September for failure to comply with employment activities. 8 of those were in the all families category, which is what affects the participation rate. 9 were in the safety net non-MO category, and 13 were sanctioned for noncompliance with substance abuse requirements. There were 44 individuals in the sanctioned status as of September, and 32 of those are beyond their sanction duration. So those are people that could count in the participation rate once they get beyond their duration, even though we can't require that they do something. The non-exempt, exempt numbers, the number of exempt continues to exceed the number of non-exempt, so the exempt number is 896 versus 638 non-exempt. And of those 638 non-exempt individuals, 351 were in the all families category. So those are the ones that we'd be looking at that really could be required to do something.
Diane, can you explain the difference between exempt and non-exempt?
Yes, exempt, they have a medical condition, so they've been determined by a medical professional that they cannot work. And so we cannot ask them to work, yet some of those people do count when they determine this participation rate.
Oh, okay.
Yeah, so they get added into that denominator, even though
They can't work.
we
Right.
can't require them to work.
Uh-huh.
Yeah,
And I wanted to go back to, because I think the engagement number is really important, and I know we have some newer members, and
That's
even
true,
though we've
yeah.
probably gone over this before.
Good
You
point,
don't
though.
live in this world,
Yeah.
and so why would you remember? I wouldn't if I didn't need to. So when you look at that engagement number, I think it was 110.
10, yeah.
So think about somebody who is actively participating in the work experience program. So they're going to their work site on a regular basis, but they have a family emergency. One of their kids' school calls and the child has a fever of 104, and they have to leave their work site just like any of us would leave our work to go and pick up their child. And it's near the end of the month, and so they don't have time to make up the hours that they missed to go and do that. That person, even though they really did everything they should and did something that any of us would do, but because they aren't in the typical workforce and don't have sick hours that they can use, they now count, they don't count positively in that denominator. So they're in the denominator, but they're not counting positively in the numerator. Does that make sense? So it's really thinking about the system and the way that it calculates is set up to not really show us, and that's why it's so important to look at that engagement number, because that's telling you, even though the participation rate is only here, that doesn't mean that people aren't doing 99% of what they're supposed to do, or at least a high percentage of what they're supposed to do. Even though it's typically things that any one of us would be able to go and take care of in our personal lives, so.
So engagement means they are doing it, participating means,
They are doing everything that they're
Every
supposed to do,
single
working
thing.
all of the hours every single week throughout that entire period, so that month to count positively. So if one thing happens in someone's life,
yeah.
their car breaks down and they're late, or the bus, they missed the bus and didn't get there,
Mhm.
and they can't make up those hours simply because of when it happens in the month, they don't count positively.
Any rationale for that?
That's just the way that the feds have set
Yes.
up participation rate.
That's
That's why
interesting.
understanding what the number means is so important, because it's, the participation rate is just one piece of information. It's understanding what makes that up.
Mm-hmm. Yeah.
That's
thank
why
you.
Diane always brings the engagement number, because I think that tells the story far more accurately of, people are doing what they're supposed to do.
Yeah. Thank you.
Yeah, and really everything that we talk about in this report goes into how the rate is figured.
Okay.
And nobody asked us, by the way, when that was set up.
No,
For
they did not.
feedback or advice.
So of the 896 individuals who are in that exempt category, 304 were in the all families. So we have different groups of people. So the safety net category are the people that have single people, and the all families is people with children. And they're the only ones that are affected by this participation rate, the people with children, because that's the federal government that sets that rate. The state sets the rate for safety net, and the rules are not nearly as restrictive as they are for the federal rate.
A little more realistic.
Yeah.
So all families go in the participation category?
That federal participation rate category.
Okay. So it's, okay.
No, they're great questions.
Okay, I think we're next at the Industrial Medicine Associates, which is attached. There is a report attached to, I think it's the last one in your attachment. It's got the yellow highlighting. But in the month of September, 131 people were referred to IMA for an assessment. 79 of those showed for their assessment, resulting in a 39.7% no-show rate. And of the 79 individuals who were assessed, 1 did not comply with the interview, 27 did not meet criteria for treatment, and 31 were already engaged in treatment and will now be monitored by IMA. 20 will be referred to treatment and monitored by IMA. And of those, 51 new IMA clients for in short-term rehab, 3 are in long-term rehab, and 44 will be receiving outpatient treatment. At the beginning of September, IMA was monitoring 150 cases, and at month's end, 14 individuals had completed treatment and/or monitoring, and 36 were closed for noncompliance. 10 were determined to be employable, which is a rate of 6.4% for the month of September, and the average number of days to employability was 217 for the month of September.
Is that 36 non-compliant, is that normal?
Yeah. What isn't normal is the number of people being referred. That has gone up quite a bit in the last, 6 months or so.
Why?
I think it's just the state of, what's going on with the drug abuse, and, it's getting worse, and we're seeing that in these numbers. The temporary assistance caseload has really increased in the last few years. I mean, when we started tracking this, it was 2012, and so it's still down from where it was in 2012. But it's gone back to the being similar in number to what was happening in 2019, and the safety net number has actually increased, and we're higher than we were in 2018. So it's now at, the safety net number is now at 1,046, where back in 2018 it was 1,030. And the SNAP caseload, it looks like has been trending down. It remained right around 11,000 there for quite a while. And now it's 10,995 as of September, which was really similar to where it was in 2018. Applications were slightly higher than the average in August and September. But those, pretty much remain steady. Doesn't necessarily show a big difference in the caseload based on that. And I've explained before that that's somewhat because people need to reapply if they don't complete the process. We denied approximately 34% of the applications taken because they did not comply with program requirements. And that's down a bit from where it typically was sitting at about 40% before. So that's probably a good thing. The temporary housing, there were a total of 105 cases residing in temporary housing in September. And of the 105 cases, 40 were single males, 35 were single females, and 30 were families. There were 5 individuals on parole or recently released from jail. And there was no one in Code Blue back in September. So currently, we have 130 individuals and families in temporary housing, and we're averaging about 16 to 20 people a night in Code Blue. So we're having to put them currently into hotels because, not sure if you're aware or not, but we had last year had a couple of agencies providing Code Blue services, shelter services, and those fell through right at the very last minute. So we did issue an RFP to get some agencies who were interested in providing that, and we did get someone, and we have chosen someone. We'll be working with Recovery Options Made Easy, and that's just happened this week. So, we'll have to meet with them and work on getting that up and running. But that'll be really important, especially since UCAN is currently not able to take people because they have no heat. So that's been about 3 weeks. We had to, move people to hotels for that. So, of course, it's the worst time of year for something like this to happen. But
How many hotels are you utilizing?
we have only a couple for Code Blue. So we had UCAN, the Mission, and then we have one North County and one South County. Then we have a couple of more that will take temporary housing people. So I think 1, 2, 3, 4. I think it's 4 hotels, 5 hotels. I missed one. But we've been able to manage even with just 5 hotels with the people that we have. So that's good.
So you're gonna be working with Recovery Options Made Easy to create temporary housing,
A code blue shelter.
a cold blue shelter.
Right,
Okay.
so these are typically people that either don't want to or can't comply with the temporary housing rules and end up being housed only because the temperature has fallen to 32 degrees below, including wind chill. So
Yeah.
we're definitely there.
Yeah.
Okay, I'll let Katie talk about her report.
Yeah, I mean, there's, our report is pretty straightforward. We are running all of our programs as usual, and I think that it's taken us a little while. Like, I don't even like to use the word like post-COVID, pre-COVID anymore, because I don't even like to bring up COVID. But it did take us a little while. Number one, the state didn't require work activities for a period of time after everything else was basically all up and running. But, we're fully staffed. We, a couple of months ago, we were able to finally hire a bilingual job readiness training facilitator, and so we're able to run at both ends of the county, English as well as Spanish-speaking job readiness trainings. So we're thrilled about that. We already really talked about work experiences, but that is, up and running. Work sites that don't have people are asking for them, and so again, it depends on transportation, where people are located. Just because we have a work site that will take people, if we don't have people that can get there, we have to place them someplace different. But that's all up and running. And I just wanted to give a very brief update on some new funding that came in to the county through OTDA, Office of Temporary Disability Assistance, which is the same state agency that funds our summer youth program. And they are funding now what's called a youth employment program. That's their name for it, so YEP. YEP, because we're all about acronyms in our world. And it is basically identical to the summer youth program, so it's for young people between the ages of 14 and 20, and it is a paid work experience. And because it's not just in the summer, this will be able to be up to 12 weeks in length. The funding just became available as of January 1st. And this round of funding is only good through June 30th, but the summer youth funding comes in May. And so what we're thinking is going to happen is it's just going to be a continuum throughout the year. It's just, they're going to still call the year-round part, the non-summer, YEP, and then the summer youth employment program, so the SHYEP. But why it's important to know is that there was a gap for especially in-school young people that wanted to gain that work experience during the school year, and also those out-of-school young people that for whatever reason aren't able to find and keep a job on their own. And so it's really giving us an opportunity to really build on all of the great work we've done in the summer youth program for all these years. So we're really excited about it. We actually brought on two what we're calling retention specialists, which is the exact same name as what we call our summer staff. So it's hopefully a little less confusing. They just started last week, and they're already out recruiting for the program, and we're working really closely with the social services department on referrals, and also making sure that how we are doing outreach to current clients, so that already have a case opened, that we're doing it really thoughtfully, but also very urgingly, for lack of a better word, that this is really a great opportunity. And one of the things that families become very concerned about in the summer, and they will with this program as well, is that this will affect their benefits somehow, and it does not. And so making that really clear right out of the gate. So just wanted to make sure that you knew that that's a new program that we should have some young people working in the next few weeks.
What are the typical work experiences?
Well, the
Examples.
great part about this one is, so with the work experience program for family assistance individuals, those have to be at nonprofits. This can be anywhere. It can be at a private sector business. It can be at a nonprofit. There are no restrictions on that. And we have a full database of many businesses that have been both private, nonprofits,
Right.
schools, you know, the full gamut. So we have a nice long list, and what we do is if we do get an individual, because this is countywide, so a young person who we don't have a work site that's within where they have transportation for, and oftentimes it's walking. And so we do 1.5 miles is our typical limit for how far we would ask someone to walk to work. We'll job develop specifically for that individual, so.
Any other questions?
I have one associated with temporary housing.
Mm-hmm.
People we are temporary housing are Chautauqua County residents, right?
Mm-hmm.
And they're community members, right? And I guess, you know, we're very limited of places that we can actively house them, right?
Yes.
So unfortunately, you know, they're in the communities and they are community members. And I know that you are always actively searching for new places. You know, is there any other additional places on the horizon too to help kind of fill some of those gaps that we have, but also they will be in those community places that are currently taking them as well too, right? There's no other place to put them either, but also
Right.
that is a place. It's a community place for those community residents, right?
Mhm.
So.
Yeah, so Chautauqua Opportunities is working on opening, I think they're calling it the Hope Haven Women's Shelter. And they're looking to start construction on that in the spring or early summer. So, you know, it's still a long process for getting any of these things up and running, but we're hoping to have that. I think it's 12 to 13 single women that they can take at that shelter. The UCAN did have one that they were looking at, and they had actually purchased a building on North Main Street in Jamestown, but then ended up having to sell that building due to, you know, some problems with the building. They were going to do a shelter for women and children, you know, so families. And I know they're still looking into that. They're looking at possibly doing a temporary, finding a temporary space to see how it goes, and then after they see how it goes, then they may be interested in purchasing a building and going, you know, making that a shelter also. So unfortunately, it just takes such a long time to get through all of that, you know, getting them up and running, and we have considerable regulations that have to be in place for us to, you know, put people in. So a lot of work needs to be done around that also.
Sure, so you have people and you have places that are, you know, eligible to receive these people, and so you have to send them there. And that's
Right.
really the facts. Until you can add to that list of where you can send some people, that's where they have to go, right? So
Mhm.
you're actively, you know, trying to promote other places to open, but for now, that's what we have, right?
Right.
Yeah. And we're both
Okay.
members of the Homeless Coalition, so there's a countywide homeless coalition that
Yep.
Chautauqua Opportunities oversees, administers, if you will, and, you know, there's a lot of people at the table trying to solve this real issue.
Yep.
'Cause you're exactly right, I mean, but there's only as many places as there are,
That's
to
correct.
send people.
Mhm.
Does
Thank
it
you.
go to a bigger housing problem? Is it a result
Well,
of
there's,
lack of
yeah.
adequate housing?
There's lack of affordable housing for
Affordable.
people on temporary assistance. I can tell you that when we looked at the cost of an apartment for even a one-bedroom, it's $800, and our levels don't even go that high for their full grant. So the full grant is about $400. So there's, you know, this is just going to become more and more of a problem when there is not affordable housing. So they're basically edging this population of people out of the housing market, and they're ending up in temporary housing. So, you know, what we need is different affordable housing
Safe.
for people. Yes, we need, you know, safe, meaning sometimes these people are dealing with mental health issues and they need more support, or drug and alcohol issues. So, yeah, we need different kinds of housing, and we need it to be affordable for those people going through these challenges.
And we have a grant with Chautauqua Opportunities where we actually they fund a staff person in our office, part of that staff person's time to do more intensive case management for individuals who are close to work ready from the homeless population, but aren't quite there. And that staff person is helping them through that process, doing everything from driving them from Jamestown to Westfield to just get a birth certificate so that they have the documents that they need in order to be able to get a job. You know, it's hard to help somebody job search that doesn't even have an address at this point, so helping them establish, you know, a PO box, you know, things like that, and, you know, a lot of that above and beyond. So there's a lot of work being done, but it's slow, and it's, you know, it's one person at a time, which is, you know, it's great. Every win is so important, but, you know, it's just such a big issue. And to the point about affordable housing, you know, we all know prices are all going up. They are for landlords too, you know, so it's not, you know, it's not a simple, well, they should lower their rent, or they should, I mean, the
Right.
cost of everything is going up. However, the subsidies are not going up.
Right.
When was the last time New York State raised those?
I think it was 2003. Yeah.
Is there anything on the horizon that they may help, they may increase that? You know, that's obviously one of the answers to the problem too. That's very old, and they should
Right.
correct
I know
that.
that the New York Public Welfare Association does work with the governor and trying to, you know, raise the rates, and they have sent a letter, you know, this is a problem across all counties in New York State, so they have urged them to look at those. Last time they raised that up, the landlords raised the rent also, so I don't know that that will help us, but, you know, we can hope that it will help, because it's severely outdated, the levels that they are at.
So I have two questions, or so the Chautauqua Opportunities, Hope Haven, my understanding is that they have a lot more support there. They have people, so it's a very different, I think, temporary housing experience even than being at a hotel, is my
Yes.
understanding.
Yeah, they will have staff on site, and where when you put someone in a hotel, there is really no supportive services available at the hotel for people. And, yeah, so that'll be an important aspect of it.
So in a world where you had like all this extra staff, I know you're short staffed,
Right.
but to put somebody in there would be the ideal, even at a hotel or
Mhm.
something at that kind of, because there's supportive services needed.
Yeah.
Yeah.
We've even had conversations with at least one hotel about having some space where mental hygiene workers can come in, or my staff can come in and provide some services on site. So we haven't quite gotten to that point yet, but they seemed open to it, so.
Oh, okay.
So it's something that still we're hoping to have happen.
The other thing I wanted to ask was, in Dunkirk, there's affordable housing I'm aware of that's relatively new. What is the average cost of housing that, in true affordable housing? I'm assuming it's less than privately owned?
Yeah, you mean in subsidized housing?
Yeah.
I'm not sure what that is. I'd have to look at that.
I mean, I'm sure it varies depending on things.
Yeah,
but-
yeah. And I still think there's a waiting list for some
all
of
of
those,
those,
even
yeah.
all that new housing that they built over there. Such a need, you know. I think some people had moved out of the county and then moved back once they had that,
Yeah.
yeah.
But you don't have that in Jamestown, huh?
No.
Or Jamestown doesn't have that?
I mean, there's some housing that Stell has, the Southern Tier Environments for Living. And I think that's who runs the one in the Dunkirk area also. But there's just, you know, the need has gone up for this type of housing, so.
Thank you.
Mm-hmm. Anything else?
Anything else?
Okay, thank you.
Thank you.
Yep.
Okay, that brings us to item number 5, which is our presentation for rehab, skilled nursing, and assisted living operations by Lisa Haglund, President and CEO of Heritage.
Lisa Haglund, CEO and President at Heritage. Thank you for having me tonight. I have a presentation that we can look through quickly, but I'm really just here to answer questions. This is less to talk about Heritage and more to talk about the state of the industry. I think for the first time since the pandemic, and you can go ahead and, I don't know if you're going to control it or I will. Okay, absolutely. For the first time since the pandemic and the pandemic occurring, I think people are talking about senior care, but it's really got to be a relevant conversation that's occurring in every county. And it hasn't been. And Heritage historically has not been present in our county as a county leader, even though we're one of the larger employers and we provide one of the largest service sectors. And so really I want to talk about the industry as a whole and why it matters. If Heritage does well, or if any of our senior living communities do well in this county, it creates support for our hospital systems, for mental health, and it creates a better environment for the community. When we struggle, it creates a bottleneck for all of the other support systems that we should be working on behalf of. Recently, Lutheran announced its closure of its skilled portion, which I think was shocking to some people and shouldn't be. New York State, earlier you were talking about reimbursement rates. Senior care facilities have gone around 17 years without an increase. Last year was our first increase in 17 years. So imagine you haven't gotten a COLA increase or a raise in 17 years. Every day for each resident we serve, and you'll see this further on in the presentation, in skilled nursing care we lose at least $130 per day for each Medicaid patient. In Chautauqua County is primarily Medicaid. That's primarily what we serve in Chautauqua County. And in assisted living, we lose over $100 per day. So if we have almost 500 beds, and if we're at full capacity, we are losing around $35,000 per day. When we cut that back, what happens is you have the hospital overrun. So you have patients out in the hallways. You have your county health department telling you now is not the time to get sick. And we have to be very tuned into that. So typically senior care doesn't matter until you're 70 or 80, right, if you've lived a good life, but it needs to matter because it affects even a 40-year-old going into labor and delivery.
Lisa, I apologize for interrupting you, but I just wanted to point out that you had invited Tom Holt from Lutheran to be with us today as well to speak about the state of this industry. And unfortunately, Tom was unable to be with us tonight. So we really appreciate you being here. Tom wishes he could be here as well. He offered to come at another meeting if desired. So,
Yep.
But thank you for being here.
You're welcome. Thank you for inviting me. And you can move forward. I'll go quick once I get started. Tom, unfortunately, I only invited him like 10 days ago because I forgot that I committed to do that, and he already had board meetings. But Tom has been doing this for years. One of my strengths that I believe I have, just so you know, and I have a lot of weaknesses too, but I come from the for-profit sector. So I spent over 25 years working at Northwest Savings Bank and Jamestown Savings Bank in this community. I'm a finance girl at heart. So when I transitioned to Heritage 8 years ago, I brought that acumen and business acumen with me. Tom is a bigger expert in this field. He's been doing it for far longer than I have. But what I can tell you that I bring to this scenario is you can't operate a non-for-profit mission without margin. And non-for-profits traditionally tend to not always understand that and lean into that. We have to care about our mission, but we can't always do that day to day. No. Well, a pretty little Windows window. So I will tell you we're at risk. We need to diversify. We were at risk prior to the pandemic. There you go. You got it. Now you can just make it full screen. In some of this, I'll just click for you. You go ahead. I'll talk quick and I'll remember what it says if I need to go back to a section. I really want to talk about the economic impact and why Heritage matters. And we are at risk. So we just need to be aware of that, and we need to be very transparent about that. There's no sugarcoating where we're at. You can keep going. 28% of our workforce is employed in healthcare. Heritage employs 12% of that. If you look at any of the county sites, though, it doesn't reflect that because the way we're governed, which I'd like to fix going forward. We are governed individually at Heritage Park or by our board governance in Heritage Green, the Village, Woodlands. So we have 10 different boards and entities, which is not transparent and conducive. There's a lot of layers that don't need to be there. So we don't always reflect that. We have over 800 employees right here in Chautauqua County. We're one of the top employers, one of the top 5. We did bring in 90% of the displaced Lutheran residents, which were mostly Medicaid, which will equate to a $716,000 loss for us this year alone. We took in a majority of the Lutheran staff members. However, Lutheran was primarily, and Tom can talk about that when he does come, using agency staff, which cost about triple of what an average nurse cost when you're able to hire them. So we only, unfortunately, while we brought over 90% of the residents, we were only able to bring over about 20 actual staff members. If we continue to use agency at the same rate as our peers, we will not be here in another year and a half. We infuse around $28 million in payroll buying power annually, and you can keep going forward. We currently are able to take in 581 in skilled nursing care and around almost 400 in independent and assisted living. Assisted living has turned into, there's 7 levels of assisted living in New York State, and it has turned into almost being skilled nursing care. New York State just implemented last year 3.7 per patient day staffing ratio, which is we all support. If I could have a 4.0 staffing ratio, so 4 staff members to each resident per day, that would be wonderful, but the staff is just not there. But the issue is they're putting the regulatory piece in before the reform is there. You only have 5,000 nursing home administrators in the United States. You don't even have enough nursing home administrators to run the amount of facilities currently in the United States. I think everyone knows all of this. The only thing I would point out is when I'm talking about Chautauqua County presence, we always flew under the radar. I come from kind of the corporate world. It's my job to now get involved. Heritage was in Seattle, Washington, as well as Illinois and Pennsylvania, and we're spread across New York State. I've cut that off. So we are only now in New York State and Pennsylvania. My commitment when I stepped into this role 3 years ago was to cut off the foot to save the body, and that's what we've done. So we are now focused here, and this is our primary focus is Chautauqua County. You can keep going. One of the reasons we pulled this out of the Chautauqua County Health Study, and you can keep going right through this, but one of the things I want to point out is when we don't have the proper health care and education systems, you're going to continue to see a census decline, which we continue to see year over year in Chautauqua County. A greater proportion of our residents are over the age of 65, and you can keep going, and that's going to grow by another 13 to 16%. And New York State as a whole is projecting that to grow by 25% over the next 5 years. I talked about this earlier, but we have to diversify. We can't just continue to operate these skilled nursing facilities and assisted living and full continuum of care and independent living at this current loss. So my heart is there. Both of my parents were served there. One of them passed there. I would love to just keep doing what we're doing, but it's important, first of all, that we're able to do it well and safely. Right now, even with this lack of reimbursement, I'm very proud of the fact that we still have 4-star facilities. But I would tell you, it breaks my heart to walk through our village community. While we may have staff members who can provide 4-star service, we have duct tape carpet. And we have beds that have lifts and other items that don't work. It's just not sustainable. So part of that is changing to say, how do we offer supportive services? How do we integrate with mental health, workforce development, immigration? There's a lot of different things we have to do over the next 2 years, but we have to be able to fund our way to do that.
And I just want to, I'm sure the gap has continually gotten worse since the last,
Oh.
Right? So it's
Horrible.
been compounding, right?
It
So this
has,
is-
yes.
So this is current data of this year.
Yes.
It just is continuing to get worse.
Yes.
I'm sure in the presentation you're going to tell us how we've fix this, right?
Yeah, oh, absolutely. I've got all the answers. No, that's not true. I wish I did.
So what is
I will tell you the answer is not doing what we've always been doing. Okay, so we've got to be a disruptor and we have to be an innovator. We have to figure out how I spend more time now that I'm not in Illinois and in Chicago, Illinois, and Seattle to work with our workforce development groups. We have to invest in those coming out of high school and create people that are going to be loyal to Chautauqua County. We have to diversify and not just keep doing skilled nursing care. We have to say is one unit for those seniors struggling with behavior, mental health, or drug addiction. We have to start offering transportation. Right now we have dialysis residents who can't even get transportation every week to the hospital. And we have to do that in a way where we're making just enough margin to ensure that we can provide a good mission. But it's not going to be one single bullet. It's probably going to take about 20 different changes. But to your point, the pandemic put us so far behind that right now, my job is sustainability. We spent $5 million. We're not here to just talk about Heritage, but Lutheran faced the same problems. Skilled nursing facilities had to keep doing testing twice a week, even when the hospitals didn't. We spent $5 million just on COVID tests, and we don't get reimbursed for any of that. There's been some federal funding available, but not enough. You can keep going. This just shows you, so if you were to look at $100 a day, this shows you where New York State ranks. And if you haven't read the governor's budget address yet, I'm not saying the 180 pages is fun, but if you skim it, New York State is falling behind. We're falling behind in education and we're falling behind in healthcare, the entire state. We're also, on this end of the state, paying for what's happening in the cities. So you have a lot of punitive measures going into staffing ratios and regulatory reform because there's a lot of for-profit skilled nursing facilities that are happy to operate as a one-star facility and make money, and the quality ones are paying for that. But if you look at this, Delaware, for every $100 it costs them, they get reimbursed $129. That's basically what that's saying. New York State went 15 years without an increase. We're at $76. So for every $100 we spend in the medical, we're getting reimbursed around 76. And you can keep going. We need to have a strong healthcare system. I think we all agree on that. Most of us don't care about it until we need it, though. However, this trickles down to every area for all of us. 14% of our seniors are age 55 to 64. I talked about that earlier, expected to increase. And we have to recognize that we actually have a higher death, morbidity, and mortality rate because of access to some of these things. And I believe when we fix this, it matters to all of us because we make the county a more attractive place to stay. You can keep moving forward. Thank you for being my little wingman back there. I think everyone knows this. You can keep going. We want to make sure that we can support our hospital systems. You can keep going. We want to make sure that we do reduce the strain on Medicaid. We recognize Medicaid can't cover this strain, and there's other ways, but home health care is one of them. Increased assisted living is another. Outpatient therapy is another. But in order to do all those things, we have to have staff. Right now, the push, and I went through this with my in-laws, is to move people to home to reduce the strain on Medicaid. The average length of stay used to be 30 days. It's now 14. I'm not a doctor, so I can't say whether or not I agree with that, but I can tell you at day 14, my father-in-law was not ready to go home and care for himself after a massive stroke and open heart surgery. And yet he did, and it then cost us around $35 an hour to bring in private care, so around $26,000 a month. But it went from being a burden on the state to a burden on the family. However, finding that help, we were only successful 50% of the time. He then had another fall at home, broke a hip, ended up back in the hospital, back to the nursing home, got COVID, passed 3 months later. So you can see where this strain just creates more of a bottleneck for the hospital and everyone else. You can keep moving forward. One thing that is really important is collaboration. We had prior leadership that did not prioritize that. It's my job to change that. We need to work collaboratively. There is a lot of things we can do together. I don't have all the answers. I wish I did. But we also want to be aware of, I think, we are underfunded and we are not getting as much attention in this side of the state. I just left Albany yesterday, And it's really painful to watch kind of the discrepancies that are occurring. One example is Lutheran, as well as several others in the area, would have been eligible for VAPTAP funding through the state. The state got that funding about a year ago. We all applied a year ago. None of that has been released. It's being released on the other end of the state frequently for less need and less quality pool measures. You can keep going. This is right from the governor's budget address, but New York now ranks 46th in the nation. This is right from her address that you can read online now. In emergency department, hospital quality and safety ratings rank similarly low. And part of this we have to understand is because people are being readmitted from skilled nursing and assisted living, which then affects the regular patient going in for emergent needs. We already spend nearly twice as much, but we're not doing it as well. And our country as a whole is not doing this as well. So there's a lot to learn if you go overseas that they do better than we do. And you can keep going over. And so this all sounds really, I think, gloom and doom. I'm going to stop there for a second.
I just point out
Yeah.
that overseas, most of them have socialized medicine.
Absolutely.
So I just wanted to say.
Yes,
that.
yes.
Okay.
So I do want to say that sounds like gloom and doom, but I do think we have to be realistic. The pandemic has forced everyone to take a look at what was already broken before that. We're doing a lot right. In our county, we are offering 4-star, and we have 4 quality facilities. We have stayed open. We've had less closures here. Even though we had Lutheran close the skilled portion, they're still staying open. And they made that hard decision so they can keep serving seniors. The WCA house closed, however, they did it well, and we still have had less closures than across the country. I think our community is committed to quality, but we do have to recognize that healthcare education, we have to have investments. I love, and this is going to probably be controversial and I shouldn't say it, but I love the bills. But if we're willing to put $850 million into the stadium, we have to say, are we willing to give a 1% Medicaid increase over a 17-year period? So it's important what we do, and we have to advocate for it and not just accept it when we are 60. We have to recognize 42% of the hospitals in New York have an operating deficit, and 68% of senior living facilities have an operating deficit. You can keep going forward. So at Heritage, I'm looking to become a liaison, to collaborate, to work with agencies, to find out what space we have and how we can do things differently. We've built in CNA classes. We're working with BOCES, we're working with JCC. We're trying to partner and increase access and equity and support. We also want to diversify. We're here to support the hospitals and the doctors and our seniors. So it's not my vision, it's what do we need in this county.
So what do you see that, are you probably not done?
No, but that's okay, go ahead. She can just flip through and you can see things as she goes and I'll answer questions.
So what do you envision as, like when you say you want to be a liaison?
Yeah.
What do you envision as the stakeholders in that group?
I would like to start working more with several groups around the county now that I can be here more and focusing on that, and start working with mental health services, the aging, Office of the Aging, as well as workforce development. I think we need to look at the senior population in a different way. I think we have to have more all-inclusive centers that can serve them and their needs because the transportation is not always available. We need to be able to connect resources to people, not expect people to find resources.
Lisa, you talked a lot about diversification, and I know that Heritage previously had a daycare center. Is that something that you still operate?
No, that was one of, when I first stepped into office, we got rid of the daycare center. We've since sold that to the Y. We were losing the money on that. That wasn't really, I don't think, the proper diversification. It wasn't built well. We also closed the stables, which should have probably never been built. And we now need to repurpose that building. I would love to do that, and that would be an example to like a wellness center where you have a doctor's office. We've already partnered with Family Health Services. So you have a doctor's office, you have a pharmacy, you have a walking track, you have mental health services. If we can do that at some point, that would be great. But part of it first is just sustaining and digging out from debt.
So what are your diversification plans?
Over the next 5 years, we would like to reduce skilled nursing, That doesn't mean we would ever get rid of it, but instead of having it be 85% of our portfolio, have it move down to 60%, increase assisted living and independent living and the levels of care we offer. It would be adding on some discharge planning, and I don't want to call it home health care because I don't think there's enough staff to do that right now, but giving some sort of support services when they get home that are billable. Providing outpatient therapy, not just to seniors, but to those who are going to rehab for a hip, you had a knee replacement. We would like to look into expanding our pharmacy and working with mental health providers. I'd like to look into some immigration programs and providing nursing and how we build a larger nurse pool. Transportation is another area. There's a few more that we're talking about and doing some feasibility studies on, but nothing I can really, that has board approval yet.
So are you seeing a lot of participants in long-term care programs, and if so, what is the reimbursement like on those programs?
It's just as poor. It's just as much of a challenge in New York State.
So are the residents required to make up that gap when they're utilizing long-term care insurance?
Yes, yep.
So you're not losing as much on those?
Not as much, but it's usually the residents can't make it up, so they're required to, but it usually becomes a burden that's somewhat unpaid for probably about 60% of them. We're still making more there. We still make more on Medicare. So transitioning also to our payer sources, our CMI mix, how we do therapy, billable services, all of that matters. Partnering with the local physician group, that was actually, it seemed simple, but that was a diversification of services that allows us to bill differently and find and kind of hone in on acute needs. You're welcome.
Thank you for coming in today. What are you asking of the legislature? Why are you presenting to us today, or to me specifically? How can I help you, or what can I be doing as a legislator to help, fix this?
I would say, first of all, just allowing me to come has been helpful because I think for 30 years Heritage hasn't told its story. And I don't think anyone's talking about the senior care community and understanding the impact. So just allowing me to kind of give some information. If at some point I could sit down and have a conversation with some of you one-on-one about what do I do differently? Out of all the grant dollars, whether they're federal or even state or county specific, less than 2% goes to healthcare. So what do you think the county needs? What can I do to advocate, to get on more boards, to tell the story more? Part of this is not really to raise awareness for Heritage, it's to raise awareness for the seniors. And I think what you can do is also be telling that story. And if there's an opportunity when we need support, like this VAPAP federal funding, if we can count on our local government and community to help support us, because our voices are not loud enough in Albany.
Have you talked to your state representative?
Yes, I have, yeah.
Mr. Chairman, I again really appreciate Lisa being here
you.
today to share this information. It's not a coincidence that I reached out to Lisa and asked her to come, because the shock that Lutheran put through the community, through the entire county with their announcement, is not a unique situation, as Lisa has pointed out today. And if we collectively and New York State collectively doesn't come to grips with this problem, it's not going to end with Lutheran.
No.
Thank you.
Thank you for having me.
Do you have your contact information?
Yes, and I can leave that, yep, and I'll give it to her. Thank you.
Thank you. Is there anything else? I just want to I meant to do this at the beginning, but welcome to Phil and Susan for
Thank you.
being new on the committee. Look forward to your participation.
As I am too.
Okay, do we have a motion to adjourn?
I'm Phil.
Second? All in favor?
Aye.
I know.
She's